contact with the trainers at, these ECD institutions are very critical. So actually we can demonstrate where we had to recruit a number of staff. But I believe in the next financial year, we may do a little bit better than we have done in reduction of the wage bill. The other sector is also the agricultural extension officers, and in the blue economy, we have had to recruit quite a number of staff in those sectors.
Yeah, those could be the global causes, but the Auditor General has pointed out at specific cases where compensation of employees was not done in line with the law. And we have asked the Auditor General to reflect on the recommendations of the County Assembly and give us a more comprehensive report. The National Treasury, maybe that conversation that the Governor is alluding to needs to be had, because when fuel is used, when you fuel an excavator to do a road, that fuel is capitalized, isn't it? But when you fuel a car to go to a meeting, that fuel is part of operations. So in terms of classification, I don't know whether it's something that is in the works to take into account what the Governor is saying. When you pay a doctor to deliver health service, which is a function of the county government, how do you then classify that? I think there's been an argument that that then ought to be capitalized as development. It's contrary to accounting principles, but maybe there needs to be a way of looking at the component of staff, and then we check out which percentage are doctors, which percentage are engineers, and which percentage are those that we call sanguenas. Because you might hide behind doctors and nurses, and yet you've got a staff establishment full of ghost workers who are delivering nothing of value. So, Auditor, could you also try to test that?
Indeed, when we are doing projects, the labor that goes into that project is supposed to be capitalized. But when we are paying other expenditure like drivers for chauffeuring you, that's a recurrent expenditure and it's considered an expense. So, but sometimes the line between the two becomes very thin, because I've heard that there's a teacher who was asking me, a university lecturer who was asking me, when we do research, why should that be used as a recurrent expenditure? We are guided by accounting standards, and they will tell us when to capitalize and when to expense. Although sometimes there is a lot of judgment in that. But as he has said, we are going to explore and see what can be taken to development and what can be taken to expenditure, because actually I would treat health as a development expenditure. Thank you.
But this kind of breakdown analysis, if you have a county public service board that is functional, then it's also possible to get a breakdown that, fine, we have put it as recurrent, but we are able to tell that the productive workers are taking this percentage and the rest, the joyriders, are taking this percentage. Isn't that possible to break down, OAG, if you demand from the county secretary and the public service board?
Well, sometimes it's difficult to do that share unless you are looking at a manufacturing entity. When it comes to hospitals, even a nurse who works in anesthesia is equally as important as the doctor. So there is a very thin line between that development and recurrent expenditure. But going forward, what I'm saying is that I will consult even ISPAC to see what they have to say about it.
Okay.
But we also have access to our international bodies. We can also see how they treat.
Yeah, let's see how to bring that clarity. Governor?
Yes.
Chairman, I think it's also important to look at the full picture. If you look at what we are putting in development, Siaya now we are at about 37%, and we are trying to get to 40%. So we are suppressing some operations which we think are not critical, in order not to compromise investment into development projects and sustaining the ones that we have built. And there's another issue, if you allow me to comment, which has brought some bit of controversy. This health workers, if they were to be recruited by the County Public Service Board, then they have been recruited in accordance with the laws of Kenya, which commonly we are moving away from having casual workers, because literally those are contracts of enslavement. Now, these health workers are paid stipends by counties. If they were to be recruited as workers, then our wage bill will shoot up, because then you have to pay them living wages instead of paying them a stipend. And what they're paid is not a salary, it's a stipend. And I hate that in our counties, we are paying people 3,000 shillings and hoping to sustain them as health workers. It can't really work. But it cannot be the subject of recruitment by the County Public Service Board, because County Public Service Board can only recruit people who are engaged in terms of the Employment Act, and not on the basis of the kind of stipend to pay the health workers.
Yeah, that's also another matter that the Council of Governors and national government are yet to agree on. The Governor Muthomi Njuki was here. He's the chair of the Health Committee, and I think there were some conversations with respect to that. I'm not sure whether you have resolved the impasse on particularly on Okay, there's UHC and then there's the community health practitioners. On UHC workers, have you absorbed your share of employees?
I think the matter is still not fully resolved, because UHC workers were actually engaged by national government, and you find most county governments will not be able to foot the bills for UHC workers. But as regards the question of resolution of the debate around health workers, there was a period where we were in competition, where national government was paying part of the stipend directly, and the county governments were paying the stipend also. I think the decision should be made is whether they should remain in the domain of the counties and resources be channeled to the counties, and the national government would have nothing to do with the health promoters, and should be left, and then if it is left to the counties, resources should then follow functions.
Though, Governor, to be fair to the Senate has already approved an additional allocations bill or act that has transferred the CHP component to the counties. In terms of the salaries, the national government portion should come to the counties so that the counties do the payment. But we still hear the national government paying directly.
Still being paid directly by the national government.
So what should be done? Because that's a violation of an act of parliament. An additional allocation bill should transfer the resources to you to do a defined function. Why should they pay directly? And I say this because in one of the mediation sessions that we had with the National Assembly on that bill, some members of the National Assembly were asking, what is the worst that can happen if we don't pass this bill? In their mind, they felt that the national government can still continue doing those things directly. Whether they are industrial parks, they can pay the contractors directly. They can pay the CHPs directly. They can pay flocker things directly. They can pay contractors on KISIP directly. That is the thinking in the National Assembly, and I think that could be the thinking also in the National Executive.
A lot of these things, if Parliament does not act as a body, then the good intentions of the Senate will negate it all the time. At least we have seen what the Senate is doing in protecting counties. But it is not an obligation only on the part of the Senate. It's an obligation to the National Assembly and to the executive. I'm not afraid to say that the intransigence in the National Assembly is being encouraged by the national government. If they were clear on this matter, I don't think these problems would arise.
Okay, honorable members, I'd hope that we'd be done with this session by 1 o'clock. We are about 6 minutes past 1 o'clock. The other thing that we must deal with, even though the auditor will report on it substantively, is why don't you have an automated system for revenue collection? That is what the Auditor General has established here. I'm extremely surprised that Siaya would not have a properly functioning revenue collection system.
We have an automated system now, although it is not yet universal, but it covers the main revenue streams, but is work in progress. And I think the Auditor General, I don't know the last time the Auditor General checked on this. We have even a dashboard where we are able to follow revenue collections by the hour, by the minute. It is there.
Governor, if that was the case, could you tell us how much of your own source revenue is collected through the system and how much is collected manually?
Chair, to answer on behalf of the Governor, we have 11 structured revenue streams that is collected through the system. And then we have an additional unstructured 14, which is not collected through the system.
In terms of values?
Value for the 11 contributes like 95% of the revenue. The other unstructured contributes like 5%.
Auditor General, your concern was that it was not fully implemented, but the county is saying that 90 what percent? 99%?
95% of structured revenue utilizes the system.
So they are talking of 95% already in the system, or is that the position?
Yes, you know, 95% is not 100%. Yes. So what I'm saying is not fully automated. But going forward here, we already have some team members who are in the field, and we are going to call our ICT personnel, experts, to come and see how the project is going.
Senator Cherake?
Governor, according to CRA, I think the fiscal analyst Salat is here. What is the revenue potential of Siaya as of today? The revenue potential. Yeah, revenue potential of Siaya as of today, as opposed to what you actually collected, because it will point out into clarity of, through the chair, the revenue collection systems. Because the reason we push for automation of revenue system, and I sit in ICT committee, is to ensure that the leakages are sealed. So what is the revenue potential vis-a-vis what you are collecting?
Governor?
At the moment, we don't have a valuation role, but I think in 2 months, we'll accomplish in having in place a valuation role. If you have that valuation role in place, I think we can collect anything beyond 1.5 billion shillings. But even without that valuation role, ever since we automated, I think our revenue collection has gone up by about 35–40%. We started my first year, the collection was about 400 million. Now we are at the close of the month, this month, and the close of the financial year, we think we'll be at about $1 billion in 2 years.
So, Chair, so apart, I told the CRA fiscal analyst, what is the revenue potential of CRA according to CRA?
Chair, as per CRA estimate, the revenue potential for Siaya County government is 1.1 billion. In comparison to neighboring county like Homa Bay, then Homa Bay has less revenue potential than Siaya, but they collect more revenue than Siaya. Yes.
But that debate here.
And Governor, I'm just looking at it,
Yeah.
because your reported growth in revenue is coming from hospital fees,
Correct, that is where
from 273 million to 382 million. And we have had this debate about doing business with the Síck. And with FIF,
Yes,
then these numbers are not going to appear on this schedule,
correct.
will they?
In revenue collection in hospitals, without automation, quite a lot of that money was not being collected. In fact, we started by going into the hospitals. In fact, the two first institutions we went to was the County Referral Hospital and Yala Hospital.